Hey guys, it's September the 27th, 2025, and I hope everybody's been having a wonderful day so far today. I hope everybody's having a great start to their weekend, and I hope it's a nice sober start to your weekend as well. Like I was talking about in yesterday's video, we've got this hurricane that, well, one of them is a hurricane and the other one was a tropical storm that they're saying is, most likely going to end up turning into a hurricane. And it's still too early for them to know for 100% sure what's going to end up happening with this. So we're just going to hang on and just see what happens. I've been doing a lot of praying and, I just hope that it doesn't hit us, not just for myself, but for everybody. I mean, people lose their lives in hurricanes. It's dangerous. And, I just hope it doesn't happen just for everybody's sake. But we'll just have to wait and see. Like I was talking about yesterday, we're really prepared. We're ready to go for this. So if it does happen, it happens. If not, it's a blessing, so we'll just wait and see. It looks like Monday or Tuesday is going to be the day that we're going to find out for sure if it's going to hit us or not. So my kids are out of school for fall break right now for the next 2 weeks, so that's one good thing about it. I don't have to worry about them, going back and forth to school and all that kind of stuff. So we'll just have to see what happens with this. But anyway, what I wanted to talk about today is that pain in your liver. This is one of those things. I've done multiple videos on this, but I think this is one of those videos that's very, very important to discuss because I think there's a lot of people walking around dealing with this right now and, haven't done anything about it. I went for years with that pain in my liver and never went to a doctor. And if I did go to a doctor, I never disclosed that. I never, told my doctor, hey, by the way, I've been having this pain in my liver. It's been going on for years. Sometimes it's a dull pain. Sometimes it's a sharp pain. Sometimes I get pain, that radiates to other places. I never once ever said anything to a doctor about it. I just let it go, because in my mind, I've spoken about this so many times that, in my mind, I thought that I'm going to get sober. I'll be able to handle this myself. I always wanted to take care of things on my own because I thought that I could. And obviously alcohol was one of those things that I could not get away from on my own. I needed some help. And when I finally ended up in the hospital with pancreatitis and my liver shutting down and all that stuff, I had internal bleeding going on. I was very, very ill. It took that. Ending up in the hospital and almost losing my life before I finally decided to get sober and to stop drinking. But that's what it took for me. But anyway, like I said, I wanted to discuss that pain in the liver today because I think it's very important to talk about. So let's go ahead and dive into it. So when I'm talking about pain in the liver, like I said, this doesn't necessarily have to be a sharp pain. It can be a dull pain. And like I was saying just a minute ago, I used to get all of the above. I would get very sharp pains in my liver sometimes, and it wouldn't last. I'd get that sharp pain, it would happen for a few seconds, and then it would go away. But I would get that sharp pain, it would come and then go, come and go. And I would get these, like I said, like really sharp pains in my right-hand side. If you feel on your right-hand side, right where your rib cage starts, right below your breast, right below that, like right below your rib cage is where I would get that pain. And I would get it right behind my rib cage too, just in that general area on my right hand side, right where my rib cage ended, right in that area. I would have a constant dull pain there. And I've spoken about this so many times, but the only way I can explain it is like I could feel my liver was there. It was just this constant feeling like my liver had become very heavy is the only way I can explain it. It just felt like my liver was protruding all the time. It felt like my liver was swollen, if that makes any sense, which is what that pain is coming from. And I'm going to get into that right now. So like I said, the pain in the liver can either be dull or sharp or both. And you can end up with pain in the shoulder. You can get pain in the neck, and especially in the right-hand shoulder. So this is my right shoulder right here. I used to get a pain that would come straight down my shoulder blade, right through here, right in this area right here, right between your shoulder and I guess I can't remember what this is called right here, but it would come right down through there, your lats. but it would come right down through this area and go down. And it would hurt. I mean, it would hurt so bad that I would have to grab my shoulder and then I would lean over. You know, whatever I was in the middle of doing, I had to stop when that would happen. It would make me stop whatever was going on. I could have been in the middle of cooking dinner for 300 people, and it would stop me. I would have steaks all over the grill or something, and I would have to stop whatever I was doing and pause because it would hurt that bad. You can also get pain in the front center of the belly, pain in the right hand side, right where the liver is located, and you can get pain in your back as well. You know, a lot of times this pain will radiate to the back. It'll radiate up to the shoulders, and it'll also stay right there where your liver is located or in the center of your belly. And like I said, it feels like your liver is distended. It feels like your liver's swollen, like it's pushing against your rib cage or pushing against the abdominal walls. That's how it felt for me. I used to feel that all the time, like every single day, and especially after a really heavy night of drinking. I would wake up the next morning. As soon as I woke up in the morning, I would feel that dull pain, like I could feel my liver there all day long, and my liver would hurt the rest of the day, the whole entire day. And the crazy thing about this is I used to use alcohol as a painkiller. Alcohol helped me with a lot of different things. You know, I used alcohol for anxiety. I used alcohol for social interactions. I used alcohol when I was sad, mad, angry, whatever it was. But one of the biggest reasons I used alcohol was as a painkiller. And it really worked as a painkiller for me. If I had a lot of back pain, I would drink and the pain would go away. If my legs were hurting me, I would drink a lot of alcohol and that pain would go away. But another pain that I used to get all the time that alcohol used to help get rid of was that pain in my liver, and I would drink. I also, whenever I would get pancreatitis, I would drink on top of having pancreatitis because it helped to get rid of that pain. So I'd be right in the middle of pancreatitis drinking straight liquor. As a matter of fact, I can remember one time I was right in the middle of pancreatitis and I didn't have any more vodka. All I had was a bottle of scotch that I'd been holding on to that somebody gave me like for Christmas one year. And I was not a scotch drinker. I just didn't like it. But that day I drank scotch because I didn't have any other alcohol. It was only the scotch, and I drank it straight in the middle of pancreatitis. And I remember getting up and walking around in my backyard because my back hurt so bad that I couldn't lay down anymore. And I thought that if I got up and walked around that it would make my back stop hurting. I was walking around in my backyard because my back hurt so bad with a rocks glass filled up to the top with scotch in it, walking around in the middle of pancreatitis. But anyway, that's kind of stuff I used to do. And like I said, whenever I would get that pain in my liver, I would drink and it would make that pain go away. Sometimes it would make the pain worse, but most of the time it made the pain go away. And I drank on top of it all the time. So what can cause this? And I've got some notes here, but I've also got something right here. I'm gonna pull this up and we're gonna talk about the causes of that pain in the liver and kind of go over some of this information here. So even though it's the largest organ inside of your body, it can be hard to tell if pain is coming from your liver. It's easy to confuse pain from your stomach. Your liver is the upper right of your abdomen, belly area, on top of your stomach, intestines, and the right kidney. So liver pain location. Depending on the cause, you may feel pain in the front center of your belly, in your back, neck, or your shoulders, especially the right one, just like I was talking about earlier. And I did not even know that until after I started doing this show about that pain in the shoulder was associated with liver disease. I used to get it all the time. I had no idea what that was. I had no idea. And then after I got sick and started doing this show and started looking into this, I found out that is one of the things that comes along with it is that pain that happens right here in your shoulder on the right hand side. And it used to be debilitating when it would hit me, like really. So having liver pain doesn't always mean you have a serious condition, though liver pain can signal a more critical issue. The following are common causes of liver pain. So alcohol-induced hepatic steatosis, also known as alcohol-induced fatty liver disease. This form of liver disease is caused by drinking too much alcohol over time. There are 3 stages of this disease. It starts as alcohol-related fatty liver disease, progresses to alcohol-related hepatitis, also called alcohol hepatitis, and can turn into irreversible alcohol-related cirrhosis. The latter two can occur at the same time. So pain is one of the symptoms of alcohol-induced fatty liver disease. So you don't necessarily have to have cirrhosis. You could have fatty liver and start to have these pains in your side. So, and one of the things about fatty liver is that it can be reversed. So just keep that in the back of your mind. So the pain is typically around the upper right abdomen. When people develop liver disease, there are some associated symptoms that may be present. This liver pain is not actually from the liver, and this is what I wanted to get into. It's not the liver that's hurting, because the liver doesn't actually have nerves in it, but it's from the reactive inflammation of surrounding organs and tissues, or enlargement of the liver stretching its capsule. The type and severity of these symptoms is depending on the underlying cause, and like I was talking about just a little bit ago, it felt like my liver was distended, like it was swollen, and that explains a lot. I used to wake up and I could feel it. I would lay down in the bed at night, or sometimes I would be laying there in the morning before I got up, and I would press down. Laying flat on my bed, I could press down on my left side, and I could actually push in down below my rib cage. I could push in and get up underneath the rib cage. On the right hand side, that did not happen. When I pushed down right there, if I was laying flat, I could not get my fingers to push down any further than past my ribs. So it would not go down anymore. Like, I could not get my fingers back behind my rib cage on my right side where my liver was, because it was so swollen. It was like super hard right there. I could push on it. It just felt like a rock on my right hand side, all the way from the center, all the way over to the side. And that was every single day. It's raining on me out here right now too. Another cause can be viral hepatitis. Viral hepatitis is an inflammation of your liver, and it's a form of acute hepatitis. The three most common types are hepatitis A, B, and C. They're caused by different viruses that infect your liver. Hepatitis can cause pain in the upper right side of your belly, where your liver sits. Other signs of hepatitis include dark-colored pee, yellow skin or eyes, known as jaundice, tiredness or fatigue, nausea, or vomiting. Most of the time, liver disease is silent. However, when there are symptoms, the most common cause of liver pain is acute hepatitis. And then you have metabolic dysfunction associated steatotic liver disease, or MASLD, formerly known as fatty liver disease and non-alcoholic fatty liver disease. MASLD happens when too much fat builds up in your liver. It's not caused by alcohol use. You may have an increased risk of MASLD if you're clinically classified with obesity or have type 2 diabetes. Though genetics and race are known factors that impact people in some populations to have MASLD more than others, you may be able to slow or reverse MASLD through weight loss and physical activity. This is one of the great things about fatty liver, is that it can be reversed with proper diet, stopping drinking, whatever. And this one right here is talking about, non-alcoholic fatty liver disease. Says you may not have any symptoms at all if you have MASLD. About 30% of people worldwide have this disease. 30% of the total population of the world have MASLD, or fatty liver disease. Pain may be a signal that you do, so paying attention to how you feel may be critical. Some people with MASLD have reported pain in the area around the liver, or a dull ache or sense of fullness in the upper right hand side of the abdomen. Just like I was talking about, that feeling of like distended fullness. That's a great term, and I didn't think about that, but that's how I felt all the time when I was in active addiction. I felt full all the time, like I had just eaten a whole bunch of food and I hadn't had anything to eat. It's just, my stomach always felt like it was full and being pushed out. Another cause can be metabolic dysfunction associated steatohepatitis, or MASH. MASH is a type of non-alcoholic liver disease. It used to be known as non-alcoholic steatohepatitis, I can't pronounce that word, or NASH. MASH happens when fat builds up in your liver, but it's not from alcohol use. MASH is an advanced stage of MASLD. Symptoms can include pain in the area of the liver. Another one can be cirrhosis, which is what I deal with. If your liver is damaged severely, it can cause permanent scarring that can affect how the organ functions. Alcohol and drug use, viruses, or metabolic factors can cause cirrhosis. The scarring can lead to liver failure. Pain in the area of the liver can be one of the first signs that you have cirrhosis, but pain doesn't mean that you necessarily have cirrhosis either. Another one can be Fitzhugh-Curtis syndrome. Fitzhugh-Curtis syndrome is a rare condition that's also called perihepatitis. It causes sudden, severe pain in the upper right section of your belly that might spread to your arm and shoulder. It happens in women and those assigned female at birth. The bacterial infection inflames the tissues around your liver and can affect the lining of the stomach. If you have it, you also have fever, chills, headache, and feel ill. And another thing that can cause this is a liver abscess or a cyst. A bacterial, fungal, or parasitic infection in your liver can form abscesses or a pocket of pus that can lead to pain. The top right side of your abdomen may be tender. Your doctor may be able to feel that your liver is enlarged. Usually, you'll also have fever and chills with an abscess. Cysts are pockets of fluid, but they aren't usually infected. They are large. They may make you feel uncomfortable, mostly because you feel full in your abdomen. Cysts sometimes can bleed, which can cause sudden severe pain in your upper right belly and shoulder. Most cysts may not require treatment, while others may. I've had a bunch of cysts, and they go in there and they put stents in them, and then they'll drain them off in your stomach or whatever. They can be rather painful when you're dealing with those. An abscess is a pocket within your liver that's filled with pus, also known as a pyogenic liver abscess. Just like a cyst, it can be painful in the area of your liver. Causes can range from abdominal infection, like diverticulitis, to a perforated bowel, blood infection. Recent endoscopy can cause it, or other trauma. Some people have pain in the area of the liver or neck. The abscess can be drained to provide relief. Budd-Chiari syndrome. Budd-Chiari syndrome is an uncommon disorder resulting from a narrowing of the veins that lead to blood and fluid drain from your liver. It can be caused by blood clots and swelling in your liver. Often it'll make the top right side of your abdomen hurt. I wonder if I have that Budd-Chiari syndrome, because I do. I have a lot of problems with narrowing of the veins and blood clotting going into my liver. It's one of the things I'm dealing with right now. It's why I've already been to 3 different hospitals and been denied, because I'm trying to get, I have a TIPS that's in my portal vein because I had a total blockage in there. They placed the TIPS, and then about a year and a half later got clogged up. It was last September the first time that I ended up with a full occlusion. I got very sick, really bad fatigue, ended up at MUSC in Charleston. They found out that I had the total occlusion. They went in there, they cleared it out. I stayed in the hospital for like a week. I was in there for my birthday last year, and I got out, thought everything was going to be good. A couple months later, I went and had an MRI done. It was clogged again. They did surgery again. And then this last time, I went down to Charleston because I was having a lot of fatigue and pain, just feeling bad. They said it's occluded again, and then interventional radiology said, no, we're not doing this anymore. It's too dangerous. And that's why I've gone to all these other hospitals, the Mayo Clinic, Emory Hospital, of course, MUSC. And there's one more hospital that I went to as well. And I'm still waiting for one more hospital I'm going to go see them in December. So we'll see what they say. And I'm not going to say which hospital that is right now. But I'll let you guys know after I go speak with them and what they tell me. But once again, you know, that I might have that Budd-Chiari syndrome, whatever it's called. I've never even heard of that until right now. You have Ray's syndrome. This condition is called Ray's syndrome. Can affect all organs but cause swelling in the brain and liver. It can cause pain because fat builds up in the liver. Ray's syndrome can happen as a person gets over the flu or chickenpox. It often happens in children. Some people recover completely, while others have long-term complications that can include brain damage. Giving aspirin to anyone younger than 19 increases the risk of Ray's syndrome. Portal vein thrombosis, I have this. Your portal vein is the vessel that brings blood to your liver from your intestines. But if a blood clot blocks the vein, you may feel sudden pain in the upper right part of your abdomen near your liver. You also may have swelling in your belly and a fever. Learn about different types of blood clots, and that's what I was talking about. That's what I'm dealing with right now, and I have a lot of pain associated with that. Liver injury can be one of them, getting into an accident, trauma, falls. Liver cancer can be another one of the causes. Gallstones can be another cause. And then other causes of liver pain, I've got a list here. Immune conditions such as autoimmune hepatitis, genetic liver disease like hemochromatosis, Wilson's or alpha-1 antitrypsin deficiency, bile duct cancer, liver edema, medicine use, herbal mixes, toxic chemical exposure, and an inflamed liver. Alright, I had to move up here to my porch because it started raining so bad on me. I just got soaking wet sitting down there. I was trying to go ahead and get it done so I didn't have to move, but it's all good. I went ahead and moved up here, and I'll go ahead and finish up today's video. So anyway, I just finished talking about the portal vein thrombosis and talking about some other causes of the liver pain and what that could be. And then I have the next part, and one of the things I think I missed here, I got off on the herbal mixes can cause it, toxic chemical exposure, and then the last thing is inflamed liver, which is pretty self-explanatory right there. And it says here, see your doctor or other healthcare professional if you think you're having liver pain. It's important to know that the pain is in fact from your liver. A professional can give you an accurate diagnosis so you can get the right treatment. When to call your doctor. If your liver pain comes on quickly, hurts too much, doesn't go away quickly, or keeps you from doing normal activities, get it checked out. Other signs that you need medical treatment right away include jaundice. Jaundice is the yellowing of the skin and the eyes. You often see, the eyes will start to get like a yellow tint to them, and then they'll start to turn almost like almost like an orange color, and so will the skin. It'll start to become like a yellowish orange color. Start to look almost like a basketball, like around that color right there. Your pee will become very, 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 very dark. And when I say dark, I mean like the color of like tea, like sweet tea is about the color that your urine will become, and it has a very, very pungent odor to it as well. It's like it's just very, very concentrated urine when you're dealing with that, and it's the bilirubin that's causing that. Another thing is fever. If you're having liver pain with fever, liver pain with chills, or you have nausea or vomiting. If you're dealing with any of this stuff, if you're having liver pain, number one, if you're having liver pain, just please go speak with the doctor and find out what's going on. They might tell you that you have fatty liver, and then, it's a matter of getting your diet in order, stopping drinking alcohol if you still are, or stopping whatever it is causing the fatty liver disease. But the one thing is, like I said, is that if you catch this early enough, if you're dealing with liver pain and you go ahead and go speak with the doctor and they tell you that you do have liver disease, it's fatty liver, let's say, once it gets to cirrhosis, there's nothing you can do. Now, you can stop drinking and live as healthy as you possibly can. It'll prolong your life as long as you possibly can, which is what I'm trying to do right now. They told me I wasn't going to be here back in October of 2022. I had ended up in the hospital and was in there for 3 weeks. I almost lost my life. And the day that I went to go home, if for any of you guys that haven't heard this story, the day that, just one day, I didn't even know I was about to leave. The hospitalist had come into the room. My wife had just showed up around lunchtime, and the hospitalist walked in, sat down, and just said, we're going to let you go home today. You need to go home and spend time with your family. And I was like, what's going on? Why? And she said, you're not going to be here for much longer. And we were shocked. And I asked her, how long do you think I'm going to live for? And she said, you probably won't be here next year for the holiday season. And that was in October of 2022, and they said I wasn't going to be here for the holidays of 2023, and here we're going into 2026. And all I've done is I just stopped drinking, and I've tried to live as healthy as I possibly can. and exercise as much as I can when I feel up to it. And once again, if you find out you have cirrhosis, it's not a death sentence. It doesn't mean that your life is completely over. I'm still living right now, and I'm actually living the best life that I've ever lived with cirrhosis and chronic pancreatitis and type 1 diabetes and an enlarged spleen with blood clots in my liver, and the duct got blocked up on my pancreas. I've had so many surgeries on my pancreas, and they're talking about actually removing my pancreas. I mean, I've got a lot of stuff going on, and this is my very best life. I am enjoying life the most I ever have, because I'm not waking up hungover and drunk every single day. I'm not wasting my whole entire life away drinking alcohol, which is what I was doing before. And I never would go to a doctor because I was too afraid of what they might tell me. How to treat liver pain. First, you need to find the source of the liver pain by seeing your doctor. Once you know the cause of your liver pain, your doctor can let you know how to treat it. Most mild cases of liver inflammation can be monitored and managed by a primary care doctor. Sometimes patients will need to see a liver doctor for more extensive testing and treatment. Managing your existing liver conditions, such as MASH or MASLD, can also ease pain. Most people with liver disease or who have had liver transplants can take acetaminophen, as long as it's not at high doses. Though they have other options for pain, including some gabapentin used for nerve pain and selective serotonin reuptake inhibitors, or SSRIs, some over-the-counter medicines can be harmful, so check with your doctor before taking anything. Takeaways. Liver pain can signal a wide range of health issues, but that doesn't mean it's serious. You may have liver pain due to swelling, cysts, or abscesses, to name a few. See a doctor or other healthcare professional to confirm that the pain you feel is, in fact, from your liver. They can find the cause of liver pain and let you know how to treat it. So, the takeaway from all this is, guys, is that, liver pain is pretty common, and it's one of the things that a lot of us deal with when we're in active addiction. I know I felt liver pain every single day, never did anything about it, was too afraid. I knew that something was going on in my liver, and I used to tell people all the time, I'm having pain in my liver, I probably have cirrhosis. I used to say things like that, and I was just joking around. I didn't even know what cirrhosis even was. I just knew it was something that people got. It was something that happened to your liver, and I knew it was something that people ended up with when they drank. My idea of somebody with cirrhosis was an 85-year-old homeless man, but gloves with the fingers cut out of them and dirty, and that's drinking out of a paper bag with a liquor bottle in there, and that was my idea of somebody with cirrhosis. I didn't know that somebody like me could end up with cirrhosis. I just didn't think it could happen. And it did. It's one of those things where we always think it's not going to be me. It's going to be somebody else. I won't end up with that. And then when we do end up with it, it's a total surprise. At the end of the day, guys, if you're dealing with any liver pain, just go speak with the doctor, because you could potentially save your life. You could find out that it is fatty liver disease. You could find out that it's MASLD. You could find out it's anything. You find out you have a cyst. You could find out you have an abscess. And if it's an abscess, they need to treat that. They probably need to put you on antibiotics to handle that. If you're going on with this liver pain, you're not going to speak with a doctor, who knows what the condition might be. There might be an abscess there that's just getting bigger and bigger and bigger, and you're not doing anything about it. Or maybe it is fatty liver. Maybe it's cirrhosis. And the thing is that if you don't know you have cirrhosis, like I didn't know, and I continued to drink and drink and drink on top of it, I was just causing more and more damage to my liver every single day. I truly do wish that I had gone and spoken with a doctor years ago and had this addressed. I've spoken about this many times, but I ended up with gout because of my excessive drinking. And I've dealt with gout now for about the past 15 years. But the first time that I ever went to a doctor because of the gout, I thought I had broken my foot. And they went ahead and did x-rays and all that stuff and found out there was nothing wrong with it. And the doctor took some blood. And that's when they found out that my gosh, what's that called? The uric acid levels were extremely high in my blood, and that's when he told me you have gout. I didn't know what gout was. I had no idea, but he told me, explained it to me, and he asked me, do you drink a lot? And I said no. I lied. I told him I have a couple beers here and there, but not like that. And then he mentioned that we probably need to do a fasting blood glucose test. He asked me to come back like the next day or the day after and to fast the night before and come in that morning and have my blood drawn so they could see if I had diabetes. It's one of the things that he said that can cause gout is diabetes, and I never went. Had I had gone and had that fasting glucose test done, they would have discovered probably at that point that I did have diabetes, and they probably would have went further into and doing investigation. They probably would have found out at that point that I had fatty liver disease. They probably would have found out that I'd already had pancreatitis a couple of times. And they would have told me, if you don't stop drinking, you're going to lose your life, or this is going to go really bad, really fast. And who knows what I might have done? I might have quit. I might not have. I don't know. I'm not in that situation right now. This was years ago. Who knows what I would have done? But at least I would have had the option. But I didn't even know. And that's why I talk about this every single day on here, because I want people to become educated about the health risks that come along with excessive alcohol consumption, or alcohol consumption at all. They used to say, a glass of wine a day was great for your cardiovascular system and all this. Now they're saying no. They're saying no amount of alcohol is good for you. None. Not any. Any amount of alcohol is bad for your health. It's horrible for your health. But the thing is that, like I said, if we go ahead and go to the doctor, get checked out, find out what's going on, we could go ahead and address whatever the situation is. You might catch fatty liver right now. You stop, your liver gets back to normal, and you can go on living your very best life. Like I said, this is the best life I've ever lived right now, dealing with all the health consequences that I have because of my consumption. But I'm happy. I'm living my life now. I'm spending time with my wife and my children. I'm spending time with my friends. I'm having real conversations with people. I'm not losing my cool for no reason. I'm not flipping out just because, I'm not having anxiety and panic attacks all the time because of the anxiety, because of my consumption. Just my life is just so much better. I don't wake up throwing up every single day. Do I wake up in the morning nauseated a lot? I do, but it's because of my health. It's not because I drank half a gallon of vodka the night before. It's because I drank a half a gallon of vodka every day for years. That's why I'm dealing with this now. And there's not a whole lot that I can do about it. But the thing is, like I said, is that I come on here every single day and talk about this in hopes that I can spread the awareness and education about, alcohol in general, or addiction in general, just in hopes that I might be able to get just one person out there that's watching, to get them to maybe go speak with the doctor, or as many people as I possibly can. But anybody that might be having a pain in their liver and finally make that decision to go speak with the doctor and find out what's going on with it, and don't keep turning a blind eye like I did every single day and going, I'll take care of it. I'm gonna get sober. It's all gonna go away once I do. Well, that never happened. I never got sober. I never quit until I ended up in the hospital. And like I said, I do this every single day in hopes that I can prevent anybody else from going through the same things that I did. Guys, once again, if you're having pain in your liver, please go speak with a doctor. I dealt with it every single day. From the time that I woke up in the morning until the time I went to bed at night, I felt that pain every day, all day. It was always there. I always felt so full. It was because I had all this pressure, I guess, coming from my liver, but I felt full all the time. And that's one of the reasons I never ate as well, is because I always had that full feeling. And I guess it was from my liver being so swollen and pushing on everything else. It was probably pushing on my stomach as well, probably pushing on my pancreas, my stomach, my gallbladder, all of my organs. It was pushing on all of them because like I said, my liver was very swollen. I could feel it. Even standing up, I could feel how far out my stomach poked out on my right side opposed to my left. because my liver, like I said, was so swollen from all of that. But once again, guys, I dealt with that pain for years and years and years. I dealt with it, you know, the pain moving up to my shoulders, my arm. Yeah, I would get that feeling in my arm, like, you know, when you've been sleeping on your arm all night long and you wake up and your arm goes numb and it just hurts after that. I used to get that feeling in my arm too when I would get that pain in my shoulder and in my liver. So guys, if you're dealing with that, please go speak with a doctor. Be proactive, be safe, and you know, hopefully you won't have to deal with the things that I've had to deal with as well. And you can go on living your best life, being sober, and live for as long as you possibly can. The things that you can accomplish, the fun that you can have, you know, the things that you can knock off your bucket list after you get sober, you can actually go out and travel and have fun and do things again. It truly is a game changer and a life-changing thing when we stop drinking or using. We honestly can live our very best life. And I hope that whoever you are watching right now, I hope that you're living your best life right now as well. Guys, I'm going to go ahead and hop off of here for today. Thank you so much for watching. I really do appreciate it. And until tomorrow, I will see you guys then. I'm going to keep a close eye on this hurricane, see what's going on with it, and I'll keep you guys updated as we get closer to it. Like I said, hopefully it doesn't hit. If you feel like throwing some prayers our way in South Carolina, that'd be great too. I would really appreciate it. I really, really do hope this does not come our way. So we're just going to have to wait and see. But once again, thank you so much for watching. I truly appreciate each and every single one of you that are here. And until tomorrow, I will see you guys then. I love you all so much.